veno-atrial connections. So start off with the normal situation, and as you all know, in the normal heart, the morphologically right atrium receives within the confines of the systemic venous sinus, and that's again, as we've already discussed, the right and left venous valve, the superior cable vein, inferior cable vein, and coronary sinus. And I'll emphasize again that although the coronary sinus drains to the right atrium, it is a part of the morphologically left atrioventricular junction. And as we move on, we're going to have to concentrate more and more on what is morphologically left as opposed to what is left-sided or what is right-sided. So the systemic venous tributary is morphologically right atrium, and for determining what's abnormal, first of all, we need to know what is normal. So we've produced this cartoon for you, and you see that here we have in blue the systemic venous tributaries, and in brown we have the pulmonary venous tributaries, or the left atrium. And so in the normal situation, draining the blood back to the right side of the heart, we have the superior cable vein, draining into that the azygos vein, and we have the inferior cable vein receiving the hepatic veins. And then the third systemic venous tributary, to say it again, part of the morphologically left atrioventricular groove, but draining into the right atrium, the coronary sinus. And also a key part of this normal circulatory pattern is the presence of the brachiocephalic vein, which is diverting the blood from the left side of the upper part of the body over to the superior cable vein. Now, one of the most important abnormal situations we're going to discuss is a persistent left superior cable vein, and we've already described to you how the persisting left superior cable vein has a very regular track as it enters the back and inferior margin of the heart, and it does so between two important components of the left atrium, and they are the left pulmonary veins and the left atrial appendage. So these relationships of the normal venous structures are very important when we turn our attention to the abnormal. And here we simply list the anatomic possibilities. So we can go through and create a list. Anomalies of the superior cable vein, of which the most common is persistence of a left-sided superior cable venous channel. And in presence of a persistent left-sided channel, on occasions, the right superior cable vein can itself be absent. Anomalies of the inferior cable vein, connection to the left atrium, important but relatively uncommon. Far more common and of more significance, interruption of the inferior cable venous return with the venous channels coming back to the heart through the azygos system of veins. And although strictly we should divide these into hemiazygos and azygos for left and right sides respectively, we're simply going to talk about an azygos venous system. And then abnormalities of the coronary sinus, fenestration and unroofing, which we'll talk about several times, both today and tomorrow. And then a strange structure which is neither levo-atrial nor cardinal, yet for better or worse is called the levo-atrial cardinal vein. And I'll introduce you to what that malformation, if you haven't come across it already. But let's start with the commonest systemic venous malformation, allegedly present in 5% of all patients with congenital heart disease, although I have no way of saying whether that is true or false. But here we're looking at the heart from behind, and you'll recognize here that a venous channel has entered the pericardial cavity and is now tracking into the left atrioventricular groove and emptying into the right atrium through an enlarged mouth of the coronary sinus. And now this shows us very nicely the regular track for this venous channel between the pulmonary veins draining into the left atrium and the left atrial appendage. And it's remarkably easy, if you cut along the track of this persistent left superior cable vein, to split open the entirety of the left atrium. So in presence of this channel dissection with the heart in your hand, be very careful. This is what it looks like when you open the right atrium. You see that the pulmonary veins are still connecting into the left atrium. Here is the oval fossa itself deficient, and we have a large hole at our anticipated mouth of the coronary sinus, and indeed this is the mouth of the coronary sinus. It is large because it is carrying all the venous return from the left side. Now a key point when we have persistence of the left superior cable vein and it's draining to the coronary sinus is the presence or absence of a brachiocephalic vein. And this is obviously of far more importance during life than it is in the autopsy room. But should the channel be absent, then it's not possible simply to tie off the persistent left superior cable vein as it would be if there was a channel. Turning our attention rapidly to anomalies of the inferior cable vein, we have to consider inferior cable vein to the left atrium. And this is described, I have never seen a case myself, but I have seen a convincing case reported in the literature. More common, but again exceedingly rare, is where the flow through the inferior cable vein is diverted to the left atrium by a persistent eustachian valve. But the commonest malformation, interruption with azygous continuation. The association here is with isomerism of the left atrial appendages, but certainly not always, and it is possible to find interruption with azygous continuation in the setting of usual arrangement. So if I show you some examples first of azygous continuation, here is a rather nice example where you see the hepatic veins are continuing to drain into the right-sided atrial chamber along with a much enlarged azygous vein which is returning through the superior cable vein. And here you see that the shape of this appendage tells us that we are not dealing in this instance with left isomerism, but rather with usual atrial arrangement. And there is a well-known syndrome associated with biliary atresia, multiple spleens, azygous continuation of the inferior cable vein, but with usual atrial arrangement. And that's particularly seen in centers doing liver transplantation, and this particular specimen is part of the Pittsburgh collection, where we saw examples of this type. So, if we consider inferior cable vein draining to the left atrium, in the most instances it is because the eustachian valve deflects the flow from the right atrium into the left-sided atrial chamber. And in certain circumstances, this can be wrongly closed at surgery, putting the inferior cable vein into the left atrium. And as I say, it is described whereby an inferior cable vein drains directly into the left atrium. I've not seen it, but there are several cases in the literature, and certainly one of these has been very convincing. So the final list we need to make, anomalies of the coronary sinus. And again, the most important and most common here is persistence of the left superior cable vein draining to the coronary sinus, because as you've seen already, that produces an enlarged orifice within the right atrium. But then we need to take account of fenestration of the walls, which normally separate the coronary sinus from the left atrium, and that is part of a spectrum that leads to unroofing the coronary sinus, and we're going to discuss that again tomorrow in the setting of the so-called coronary sinus interatrial communication. And then finally, our levoatrial cardinal vein. So here, first of all, you see fenestration between the coronary sinus and the left atrium. You're looking here at a close-up at the back of the heart. This is the diaphragmatic surface of the left ventricle. And here we have our coronary sinus that has been opened from behind, so blood is flowing in this direction from the great cardiac vein towards the orifice of the coronary sinus here into the right atrium. Here is the cavity of the left atrium, and you see that there are two fenestrations here that are permitting communication between the left atrium and the systemic venous tributary draining into the right atrium. And the extreme of that is so-called unroofing. And I show you that here from the left side. I'm going to show you this again tomorrow in the setting of coronary sinus interatrial communication. But to orientate you, again, we're looking at the heart from behind, and hopefully you will now recognize that this is the mitral valve leading into the left ventricle. And here is our anomalous venous channel, and as we have already discussed, the relationship between the left superior cable vein and the left-sided structures continues to hold good, so it's sandwiched between the left atrial appendage here and the left pulmonary veins opening to the roof of the left atrium. And there you see the orifice of the coronary sinus. And normally there would be walls connecting the cable venous channel as it enters the roof of the left atrium to that what now is a hole between the right and left atrial chambers. And because of the absence of the walls that should normally have developed between the venous tributary and the left atrium, this is indeed now functioning as an interatrial communication. That again tomorrow. So finally, our levatraal cardinal vein. And here is a picture showing you the essence of the levatraal cardinal vein. It's an anomalous venous channel that is connecting the pulmonary venous component of the left atrium to the systemic veins. And almost always it is seen in the setting either of an imperforate mitral valve or absence of the left atrioventricular connection. Almost always also the interatrial septum is intact. So this venous channel is providing an overflow from the left atrium into the systemic venous tributaries. Here is one of our examples viewed from the front. So I'm showing you here the morphologically right appendage. That is the left atrium and the right pulmonary veins. And what you see is draining from the right pulmonary veins, you have an anomalous venous channel that runs up, passes behind the superior cable vein and the azygos vein, and then drains to the left side of the superior cable vein. So this is the so-called levatraal cardinal vein.